You spent years in the ER, seeing so many people dealing with serious health issues. But was there one moment, one patient that really made you stop and think, this has to change?
One of the most impactful cases that come to mind all the time is the night I met Santa Claus in the emergency room. Although this was not jolly, it was actually a nightmare for him. This was an elderly man. Think of a thin or skinny Santa Claus. So he came into the emergency room. He was my patient, and I noticed that he had a lot of wounds wrapped on both of his lower extremities, both of his legs. Now he lived alone, and he was type 2 diabetic, had neuropathy, the nerve pain, and all the things in his lower legs. But he wasn't able to take care of himself anymore. He told me that the gauze that was wrapping his legs, he wasn't sure when the last time they were changed. You could tell because they were very dirty and dingy. He had diabetic ulcers and they were draining, which is why he's got the gauze on them. At this point, Tech and I started to slowly unwrap the gauze, and that is one of the smells, one of the many smells as an emergency room nurse that you will never, ever forget. This next part might be just a trigger warning for you. As we were slowly unwrapping his wounds, there was a large amount of maggots, not just on the surface, but they were coming out. They were embedded in his legs. This was devastating for him because you could tell he was embarrassed, and he kept saying, "I'm sorry, I'm so sorry." But then he would also tell his jokes. He was an amazing, amazing man, and I felt so awful for him in this situation. He started cleaning his wounds and using saline and some peroxide to draw the maggots out, and this took hours. He eventually ended up going to the OR to get what's called a debridement for those wounds.
Wow, that must have been incredibly frustrating to see. And the hardest part is knowing that this didn't have to happen.
Yes, so if you have uncontrolled high blood sugar or hyperglycemia, which eventually leads to being pre-diabetic or a type 2 diabetes, what happens is that it causes nerve damage by directly damaging the small blood vessels. These are tiny blood vessels that supply the nerves with oxygen and nutrients. So when you have high levels of blood sugar, it causes a lot of inflammation in those blood vessels. So eventually that's going to lead to lack of nourishment, and ultimately will start impairing the nerve's ability to function properly, and will lead to what's called neuropathy, which you have decreased sensation. The doctor is always telling them, make sure you look at your feet, because that's where the nerve damage can happen in the extremities, and you lose feeling. So if you accidentally cause damage on your toe and you don't know that you did, then that could lead to infection and then ultimately amputation.
And you saw this kind of thing all the time in the ER.
Every day, I have patients coming into the emergency room with some kind of complication from being a diabetic, and this is particularly type 2 diabetes. Even a pre-diabetic is already showing symptoms of being a type 2 diabetic. They just don't realize it. Like maybe their vision is getting bad, they already have high blood pressure, maybe they are having some numbness in the feet, not really putting it all together.
Was there a point where you thought, I don't just want to treat this, I want to stop it before it happens?
Yes, because as a nurse, you see the worst of everything, what happens with your health if you don't take care of it, if you don't control your blood sugar, if you don't move more and eat right. When you don't do stuff like that, as a nurse, you see the complications. That's what prompted me to start taking action on myself, because I didn't want to end up in that position, and I also don't want my family to end up in that position. So I completely changed my health because of that. And now, this 10 years later, I decided to become a health coach because I want to help other people realize this as well, and know that you can take action. You can do the things to reverse this. type 2 diabetes and prediabetes is a diet-related condition. There's a natural solution.
For someone watching this, maybe they're starting to realize they need to make a change, but they don't know where to start. What's the first step they can take today?
First steps you have to take is to understand what spikes your blood sugar, which is food. Diet is number one. And you know what spikes blood sugar, the normal things like the cookies, the pastries, the chocolates, you understand that. But what a lot of people don't understand is that the breads, the pastas, the oatmeal, the granola bars, the things that are healthy like some fruits can spike blood sugar. So if you're doing that all day long, you're making this worse. The complications are going to get worse. That right there is why I created an ebook. I created a free ebook that has a complete list of foods. I even put some sample meals in there because I am not a chef. So they're very simple because I want this to be simple for people because this is a big change. I also decided because people need guidance, they need the accountability, they need a coach to help them along the way. So that's why I created an online program too, so I can help people everywhere with step by step, like their diet, what to eat, what not to eat, how much to eat, exercises, things to do like sleep and stress to start controlling the blood sugar and bringing that down and getting it under control. Because I want this to be a lifetime change, not just a quick fix.